Today is World Diabetes Day. Hi everyone, this is AY the Diabetes Doctor. I'm a doctor, I'm a specialist on diabetes. Today is 14 November and is the day that World Diabetes Day is celebrated all over the world. It is a day that we raise global awareness on diabetes, its impact on patients, its impact on the economy and the society at large. This year's theme is diabetes and well-being. It is trying to bring focus on the well-being of people living with diabetes. That the focus should not always be controlling blood glucose, but how the patient and individual is feeling is equally important. Over 500 million people are living with diabetes, and 1 in 10 adults have diabetes. And 50% of people that are diabetic do not know that they are diabetic. The alarming thing is 3 in 4 of people that are diabetic are seen in developing countries such as Nigeria. So this year's theme is focusing on the well-being of diabetic patients because 3 in 4 diabetic patients experience mental conditions such as anxiety, depression, and other mental conditions. And also, 4 in 5 diabetic patients experience what we call the diabetes burnout, where diabetic patient becomes exhausted and sometimes interrupts care, so that you see a situation where a diabetic patient stop medication, stop doing investigation, and just leave all the treatment because of the burden is overwhelming. So what are the factors that affects the well-being of diabetic patients? One of them, of course, is the mental condition, such as depression, anxiety. It reduces the eagerness of a diabetic patient to fully take care of himself. Secondly, is the economic cost. Because of inflation, the cost of diabetes care have increased exponentially. The cost of medication, the cost of tests have increased. This burden usually does not allow the diabetic patient to have good control and also affects the well-being of the diabetic patient. Thirdly, access to diabetes care. Though there are a lot of PHCs, but those PHCs and general hospitals do not have the adequate equipment and expertise to take care of diabetes patients. So you see that sometimes a diabetic patient will present with emergency, but they do not have both the knowledge and the needed equipment to take care of that diabetes patient. So that will ultimately affect the well-being of the diabetic patient and may bring about complication and sometimes demise. Sometimes diabetic patients find it difficult to cope with the changes in lifestyle, such as changes in diet, exercise. If a diabetic patient has challenge coping with the care of diabetes, he will tend to have issues with his well-being. Also, lack of social support. One of the major things that affect the well-being of diabetic patient. Lack of support from the spouse, from relatives, from children, from friends, and sometimes stigmatization. So diabetic patients should be encouraged, motivated, not discouraged. So with all these factors affecting people living with diabetes, what is the way out? It is advisable as part of diabetes care, diabetes patients should regularly go for mental and psychological evaluation so that if they need support, that support can be given. Secondly, diabetic patients should receive support from those closest to them, the spouse, the children, the friends and relatives. They should be motivated. They should be encouraged. They should not be seen as a burden. Diabetic patients deserve to have access to care wherever they find themselves. Not a situation where a diabetic patient presents with emergency, but there is no care whatsoever. A diabetic patient should be guided gradually on ways to change his lifestyle that he can easily cope with and have good glucose control and better his well-being. So if all these things are done, the well-being of diabetic patients will be better. For the government and those policymakers, it is important to look on diabetic patients with compassion. The cost of medication should be subsidized, and the cost of tests should be also subsidized so that it will be easier for diabetic patients to cope with the current challenges that affects their well-being. This is a message for diabetes patients. We understand how you feel. We know the burden you are experiencing, especially in the recent times. The burden of stigmatization, the burden of lack of support, the burden of lack of access to care, the burden of mental challenges. We can assure you that specialists in diabetes will make the necessary effort to give you all the support you deserve to live a healthy life and improve your well-being. If you like this video, kindly like, share, and subscribe.